Our next panel on the radar, Living Donor Protection Act, puts a laser focus on a critical issue to kidney patients and the many selfless and courageous Americans in our society who consider or become organ donors in an effort to save a life of a loved one or a person they do not even know. I'd like to begin by introducing our panelists. Our speakers will come up individually and present in order introduced. And at the end of the presentations, I'll ask the speakers to come to the head table for questions and answers. It's my distinct honor to welcome Christine Schott, a U.S. civil servant who serves as Senior Advisor for the branch of FMLA and other labor standards for the U.S. Department of Labor, Troy Zimmerman, Vice President of Government Relations at NKF, and a past recipient of the AAKP President's Award, Peter Mogg, President and CEO of CareDx, a visionary private sector leader who instituted a bold organ donor leave policy for his employees because it was the right thing to do. Peggy Tai of the Powers Law Firm and the Principal for Government Relations and Legislation with the American Society of Transplant Surgeons, and also a past recipient of the AAKP National Congressional Advocacy Award, and John Haydak, AAKP Ambassador and recent transplant recipient, receiving a living donation from his sister. Christine, I welcome you to begin the panel.
Well, hello, thank you so much. It's a true privilege to be here. I'm with the U.S. Department of Labor Wage and Hour Division. I'm here all the way from the Francis Perkins building, which if you're not familiar with Washington, D.C., is right around the corner from here. And if you're not familiar with who Francis Perkins is, she was the very first female cabinet secretary. She was the Secretary of Labor under Franklin Delano Roosevelt, and during her time as Secretary of Labor, the Fair Labor Standards Act was passed, and the Fair Labor Standards Act of 1938, which sets the floor for wages, the federal minimum wage, and the ceiling for hours, the requirement for overtime pay. That created the Wage and Hour Division, which is my agency. So Wage and Hour Division, in addition to enforcing the Fair Labor Standards Act and other laws of general applicability around the country, enforces the Family and Medical Leave Act. And the Family and Medical Leave Act was passed in 1993. I'm here to talk with you a little bit about how the Family and Medical Leave Act defines a serious health condition. Under the FMLA, an employee can take, the FMLA allows employees to take protected time off from work for certain reasons. Since 1993, the reasons that employees can take leave, protected time off from work under the FMLA, are for the birth of a child or the adoption of a child, for a serious health condition, if the employee has a serious health condition that makes them unable to do their job, or for the care of a family member. So the FMLA since 1993 allows employees to take leave for bonding, for their own serious health condition, or to provide care for a family member who has a serious health condition. Now, since 2008, the FMLA also provides employees the entitlement to take leave for certain military family members. If you have for family members who are called to service in a foreign deployment, there are certain qualifying exigencies, and for either an active service family member or a veteran, in certain circumstances, if that family member, the veteran or the service member, has a serious injury or illness, the employee has an entitlement to leave under the FMLA as well. So the first entitlement of the FMLA, the first thing that the law provides is time. It tells employers that they have to allow employees to take time off for certain qualifying reasons. The next thing it does is it protects that time. So if an employee takes time off from work, the status that they held in their work, the level that they had of responsibility, the status, their standing at work is preserved. Whatever their standing is when they leave work, their standing is the same when they come back to work. And it prohibits employers from interfering with employees who use FMLA, who have a need for FMLA, and it prohibits discrimination against employees who have used FMLA leave. Another thing that it does, so apart from providing time off, providing protection against discrimination, assuring that a person has the right to return to their same job, is that it requires employers to continue employees' health benefits as though health insurance, as though they were at work. So those are the entitlements of the FMLA. Now let's go back to those reasons. Again, going back to 1993, the reasons that employees can take leave include for their own serious health condition and for the care of a family member who has a serious health condition. So what is a serious health condition under the FMLA? The law itself says that employees may take up to 12 weeks of leave because of a serious health condition. That's an illness, an injury, an impairment, a mental or physical condition that involves either inpatient care or continuing treatment by a healthcare provider. So going back to the statute, it entitles employees to take leave if they're under inpatient care. And under the implementing regulations, the Code of Federal Regulation in Title 29, Part 825 provides regulations for the FMLA. And under the FMLA regulations, inpatient care is considered care in a hospital, hospice, or a residential medical care facility overnight. So once an employee has a condition that necessitates that type of care, the situation can be a qualifying serious health condition. And then in addition to that, a condition that has a continuing need for treatment. So an employee or a patient who has a chronic condition, a permanent or long-term condition, a patient who, for any reason, is incapacitated for 3 or more days, and they have an in-person visit with a healthcare doctor and some kind of follow-up treatment. All of these are different ways that a health condition can be considered serious under the FMLA. So on August 28, 2018, the Wage and Hour Division issued a public response to a request for an opinion asking whether organ donation surgery can qualify as a serious health condition under the FMLA. So given the different varieties of conditions that can rise to the level of serious under the FMLA, the very first that the condition requires inpatient care can certainly apply to an individual who is donating an organ. If you have a person who is hospitalized overnight, much less for days or weeks, and the person is both that time that they're in the hospital and the time that they're recovering from being in the hospital would be available FMLA leave time. So when we answered the question in the opinion letter from August 28th, we answered that yes, donating an organ can be a qualifying serious health condition. There's nothing in either the statute or the regulations that would prohibit that would make it not available as a condition for leave. Some of the things that people have asked, does it matter if donating the organ is voluntary? It does not matter that it's voluntary. In a certain sense, treatment being voluntary is true of all different kinds of medical conditions. And when an employer is deciding whether to approve or not a request for leave, when the FMLA is involved, there's not a basis for the employer to question the diagnosis that led to the person, whether there is a diagnosis or not that led to the person having a condition, the employer is looking at, and what we, Wage and Hour, would look at, and what we would ask a healthcare provider in a position to verify the seriousness of a person's condition. What we all want to look at is an objective test, and objectively what the facts are of the condition. Does it require hospitalization? Is the person incapacitated? Will they be incapacitated if they don't have a treatment? And by incapacity, that means that the person is not able to perform a function of their job duties. So for example, if my job requires driving and I'm not able to drive, then I'm incapacitated for that job. If my job requires standing throughout the day and I'm not able to stand, I'm incapacitated for that job. So the FMLA doesn't, being incapacitated doesn't need to mean that you're permanently incapacitated or you're incapacitated in all areas. So in the opinion letter, we also noted that the fact that the person who's making the donation is otherwise in good health is not a factor. So in one sense, you can think of it the same way that a person is in good health and they have an accident. They don't lose their eligibility for FMLA leave if they're involved in an accident and they're hospitalized. They have an entitlement to FMLA leave if they're otherwise eligible, and their family member has the same entitlement. So the same is true for a person who would be donating an organ. It's also true that it has no bearing in that analysis whether the person who is making the donation is related to the person that's the recipient or not. So these are all points that we laid out in both the opinion letter and in a new frequently asked question that we added to the Wage and Hour Division website in this past January. So let me just stop for a second and make sure that you have the information for going to find this and other information about the FMLA. Or if you have questions, you have family members, you have other individuals you're in contact with who want to speak with someone who's professionally trained and experienced with FMLA enforcement. So first, the web site for the Wage and Hour Division is www.dol for Department of Labor /WHD. That stands for Wage and Hour Division. And then you can go from there, you can go to /opinion if you want to see opinion letters or request an opinion. You can go to dol.gov /WHD /FMLA for all of the FMLA information, links to all of the information that we provide, including FMLA frequently asked questions. Now the phone number, you can also go though on the website. If you go to dol.gov /WHD, you can find a map to find the Wage and Hour office nearest to you. So not the Francis Perkins building, but the one where they take walk-ins more easily and they answer and they help people who have complaints. You can go to the website to find that, but you can also call 1-866-4US-WAGE. That's 1-866-487-9243, and that's a toll-free line that will get you through to any of the Wage and Hour Divisions offices in the country. And let me just say very quickly then to wrap up a little bit about, it was mentioned before what the entitlements of the FMLA leave are, but there's also limits to what the law requires. So although it covers most employers, not all employers are subject to the FMLA. All public agencies are covered by the law, states at the local level, state or federal level. All schools are covered by the FMLA. And in the private sector, all employers who have 50 or more employees are covered by the FMLA. If you are working for a covered employer you are eligible to take FMLA leave once you've worked at least 12 months, once you've worked at least 1,250 hours in the year before you need the leave, and once you've had and if you work at a location where there are at least 50 employees within 75 miles. So not quite all employees are covered, not quite all businesses are covered, and the law does not require paid leave. It is a requirement for unpaid leave, although there are provisions that employees are entitled to substitute paid leave that they have available if it might otherwise be qualifying. And we also have recently issued another opinion letter where we talk about stacking of leave if an employee has a preference to either the employer and the employer allows it. Let's say they use their paid leave and then they start their FMLA leave. We would say that the employer is obligated to designate the time off as FMLA leave as soon as they know that it's qualifying, because there's no authority under the FMLA for an employee to extend. If it allows 12 weeks, there's not a provision to be able to extend that period of time that they have the protection. So I think with that, I'll stop and look forward to questions on the panel discussion. Thank you.
Good afternoon. I'm glad to be here today. I appreciate the invitation from Diana and Paul and Richard and everybody else. I'm going to go a little bit old school and just look at notes. No slides. My topic that I've been asked to cover is a historical look at the Living Donor Protection Act. And to put it quickly, it's been introduced in the House of Representatives 4 times and in the Senate twice, and it has not yet passed. And with that, I turn it over to Peggy and Peter. So thank you very much. No, this actually started in 2014, if I recall correctly. There was an article in the New York Times right about this time of year, I think it was in July, and about an individual in Minnesota who lived in Minnesota, and he had difficulty obtaining insurance, life insurance. He was a living donor. I think he had, if I recall correctly, been denied outright. So it wasn't a question of the premium level or the coverage level. I think he had been denied a policy outright. And Congressman Nadler saw the article, and his staff contacted me that day or the next day and said, can you come in and talk to us? The congressman's interested in this issue. And frankly, I don't recall it ever coming up before. I wasn't familiar with the issue, and I don't think it was anything that was really, out there in the public domain. So I met with his staff, and we helped draft legislation. And it got introduced, and that was near the, it must have been 2014, because it was near the end of a 2-year Congress, so it really didn't have any chance to go anywhere. But since then, it's been reintroduced 3 separate times in the House, as I said, 4 times total, and twice in the Senate. And this year, it's been introduced in both chambers, so we're very glad. In the last Congress, it was not introduced in the Senate, so it's good to have bills in both chambers, obviously. They are identical, so there's no differences between the 2 of them. So if one house wants to pass it sooner than the other, that's great, and it can get sent to the other chamber. It definitely, there's been good support from everybody in the transplant community, whether it's patient groups, professional societies, the nephrology groups like RPA and ASN who were on the first panel, certainly the professional transplant societies like ASTS and AST, NATCO, et cetera, UNOS. Everybody's behind this bill, all the various groups. So far, I think certainly the pace and the progress this year has been very encouraging. Right now, there are 62 co-sponsors in the House and 10 in the Senate, and that's far ahead of where we've ever been before. I think the last time it was introduced in the Senate, it ended up with 8 or 9 co-sponsors. And the House bill in the last Congress had 87, and that was after almost 2 years after being introduced. So when the 115th Congress ended last November or December, I think it was December, had 87 co-sponsors. They already have 62 now, so certainly far ahead of the pace of where they've been before. And also I think what's very encouraging is a lot of those 62, about half of the 62 co-sponsors are first-time co-sponsors on this legislation. So that tells me the community is reaching a lot of new members, getting their support. Some of those are freshmen, so they're first-time members of Congress. Other ones are returning members but didn't co-sponsor in the past. So I think that's very encouraging to have that new level of support. And on the other hand, with roughly half of those co-sponsors being from previous years, you like to think the remaining ones from those last year are low-hanging fruit. Of the 87 House sponsors, 66 returned to Congress. The rest of them either lost or ran for governor, ran for Senate, retired, etc. So there are almost over 6 potential people from last year that we could get to attract to the new bill. So certainly these advocacy days that as Rob mentioned tomorrow, going to the Hill, RPA and AAKP together, that makes a big difference. The National Kidney Foundation, we had our own advocacy day in March, and we did that in conjunction with other patient groups, including AAKP. We did about 180 meetings, and a number of the co-sponsors signed on either that day or within a few weeks afterwards. So certainly the outreach you can do, whether it's here, back home, as Rob and Rachel said, certainly great opportunities in August to do that. So the good thing is there's no cost to this. You heard a lot of discussion in the immunosuppressive talk about now it's a cost saver. That's very true. This bill would not have an impact for the federal government because it essentially does two things. It prohibits any discrimination in the pricing or the availability or the level of benefits for life insurance, long-term care insurance, or disability insurance for living donors. And the second provision is it codifies what we just heard regarding the FMLA opinion letter. So it puts it in the law so that the Department of Labor could not revisit it, whether it's this Department of Labor, I'm not saying they would, or any future administration. It wraps it in the law so it can't be changed without an act of Congress. So we'd like to see that codified. So I do think there is some momentum. Certainly, it's good having these number of co-sponsors. It's very important to keep building that support, especially in the House of Representatives, because to be honest with you, it's heavily unbalanced with a lot more Democrat co-sponsors right now than Republicans. But also another challenge in the House is, amazingly, it got referred to 5 different committees of jurisdiction. Now, not all of those are really considered major committees of jurisdiction. Some of them have authority over only one provision, for example, one type of those 3 types of insurance. But nonetheless, it is something that if and when it moves, it would have to be approved by each of those 5 committees. So it's very important not only to attract the co-sponsors, but try to get a handful of co-sponsors from both sides of the aisle, both Democrats and Republicans, on all 5 committees. Fortunately, in the Senate, it's only before one committee. I also want to take just a few minutes to say that there's been a lot of activity at the state level. In last January of 2018, I was contacted by a lobbyist in the Idaho State Legislature who happens to be a labor lobbyist, who's also a living donor recipient. And she was working with a senator in the Idaho legislature to introduce the living donor protections. So this bill has been introduced in a number of states in the last 2 years, primarily dealing with the insurance provisions, not the job protection in most cases. And so Idaho was the first state to pass this, which was quite, surprising even to the person who was working on it, to the lobbyist. She said, we're very conservative legislature. There are 40, it was introduced in the Senate. There are 40 state senators in Idaho, 32 of whom are Republicans. And in Idaho, they tend to be fiscally conservative and socially conservative. So she was concerned it would be kind of an uphill battle, and actually is one of the 8 Democrats in the Senate who introduced it. But without much difficulty, the Senate committee made a few tweaks to it, and then it sailed through the Senate, sailed through the House. The Republican governor did a small signing ceremony, which we were fortunate to have an NKF patient and an NKF social worker present at that. And then after Idaho passed it, later in the year, New York and Maine also enacted state versions of it. And this year, 8 states have done it, and that is Arkansas, Arizona, Colorado, Illinois, Kansas, Maryland, Oklahoma, and most recently Oregon. So they've passed it in those states. A number of states, it's either pending or was introduced in addition to those 8. Pending or had been introduced, but their sessions have ended, but it is still pending in a few states, one of which is Pennsylvania. And I think, building that level of support at the states, obviously it addresses the needs of those the living donors and prospective living donors in those states. We certainly want to have a federal bill, but at the same time, when you're reaching out to your members of Congress, if they are from those states, you can point out the fact that that's already been done in their state, and hopefully they'll support the federal bill as well to provide that that widespread support. So with that, I'll just say keep as Paul and Richard said, just keep pounding the pavement, getting the word out there, emphasize it's the right thing to do. The living donors do indeed experience discrimination. There have been studies conducted that show that people either have lower level benefits, they're denied coverage outright, they pay higher premiums, and there's no reason for that. And as I tell people when I go to Capitol Hill, the average typical living donor is healthier than the average American. They go through obviously a battery of tests, as you all know. You couldn't donate if you had a health issue, and so there's absolutely no reason why they should be denied or their coverage should be restricted. So thank you very much.
I'll be talking a little bit about CareDx, just why am I coming to work every day, and that's the picture why we're coming to work every day. Thank you so much for those patients in the room. That gets me up going with sometimes very little sleep and even less sleep in Washington, I tell you. But this is what about 400 individuals at CareDx every day think when they come to work. And for those of you that know the company, we used to have 1 patient up here, and now it's 2 patients. We don't only focus on the transplant recipient, but we also focus on the transplant recipient and the transplant donor. So on this picture, you see not only the recipient, the daughter, but also the father who gave a kidney to that patient. Now, when you look into, we at CareDx, we're completely patient-focused. We are very patient-centric, and many organizations talk about patient centricity, and we really try to live it. Paul and Richard, you see them on the pictures. We share stories now over the last years. This is a 20-year dedication to transplantation. Our first software product from CareDx was installed in a hospital 25 years ago that follows patients longitudinally. So a very strong dedication to patients in our organization. Now, when we're thinking about where we have impact in the organization, I think it's important that there's really human beings. And this is a bit of a theme for this presentation, that yes, we're talking about dry legislation. We maybe sometimes talk about paper or a computer screen, but actually what's all behind it's human beings. When we're thinking about the CareDx mission, it's very simple, put into these 6 words. It's better matching. So we do matching of organs and recipients. We have the latest technology to do so. And then we do better surveillance. We monitor these patients and help clinicians and caregivers care for these patients throughout their lifetime. That leads to better outcomes. Because we as an organization focus on the patient. Our brochures are completely focused on real patient examples, and many of you know. We do have a framework that impacts the longevity of these patients. So our mission is to increase patients' lives by 3 years, from 10 to 15, maybe to 13 to 18 years. And many companies talk about it, but I think it's very important that you have a framework on how you're going to do that. You do it through focusing on immune modulation, you focus it on compliance and adherence, and standardization and personalization. Now this is what we can do. But what's the most important issue before transplantation? It's organ availability. Right? And how do you impact organ availability? And we sense that there's a responsibility at CareDx, and how we're thinking about this is, I'll share with you in a minute. We do have a vast array of products in transplantation. We truly are the transplantation company, so to speak. Now we are partner in transplant care along the transplant continuum, not only in the US, but also globally. We are moving the field in transplantation from our biomarkers over to multimodality testing, that there are multiple markers. And then many of you hear now this word of artificial intelligence or digital health. And so CareDx will marry that for the transplant community, and that's our dedication to bring that to transplant patients and their caregivers. We have a novel product, Kidney Care, where we are combining these various concepts into one. But then, how do we know the future? What does clinical genomics mean? And it does translate at the end of the day into where do I call for help? And CareDx has now an infrastructure where 60 transplant centers are using the same software. It's called the Auto software, where we are collecting patient information longitudinal in these transplant centers. Right now it's just the software. The data collection doesn't happen yet. But wouldn't it be great one day that not only the transplant center, which is here the satellite swirling around Earth, but also that there's a patient care team, they're providing you real life support and access to information. And that's what we're building at CareDx. Now, I'm turning the page back to what does CareDx do for organ availability. And when I joined the organization, what struck me is here in the United States in this healthcare system, it's incredibly difficult to incentivize transplantation. It's very difficult. But what really is established is that there is some disincentive for transplantation. And so let's not focus on incentivizing, let's focus on removing disincentives. And it was striking to me when you read the press and you hear the patients that are struggling to become a living donor or having access to organs, that they're true disincentives as employees. And what did we at CareDx do? It sounds really simple, but we put down on a sheet of paper, how does a policy look like as a responsible employer? How do you support living donation? And it all took one piece of paper, a few paragraphs, few words, that made it really clear what we as CareDx, as employer working in transplantation, need to do to make sure that there is no disincentive for any employee that wants to be a living donor. And we did that beginning of last year. Yeah? So that's already, I think, 18 months ago. You see me here speaking. It must have been in one of the great AAKP events that I think we actually announced it. So thanks to the team here with Richard and Paul. No, we announced it, and I think it spread. It really spread because it was so simple. So we had very large employers in the US saying, what is CareDx doing? And we got very, very positive responses. So sometimes it's just a little spark that's needed in order to generate a lot of thinking. So this was a great policy, the leader policy. And in the same vein, I will make now a bit of a pivot into what does a company then bring? And we do bring passion. There's tremendous force by just being very passionate about an issue. We do have people. Yes. We do have a lot of individuals that do and are completely dedicated. But don't think of us as resources. I'm happy to be a gold sponsor. But more importantly, we're human beings. Don't think of us as a resource. So they're dedicated humans that are working for us as a company that are supporting the cause. And then we have a lot of tenacity. My favorite word in English is grit. So passion and perseverance in the pursuit of long-term goals. So I do think that we are here as an organization for the last 25 years dedicated to transplantation. And if you think in the next 25 years, think about CareDx and transplantation. Now, one thing that came up earlier, which I thought that, I was almost jumping up, I couldn't help myself, but I did then. I'm older than the organization now, so I'm starting to become constrained. But there is one place to go if you want to support the Immunobill. This is Honor the Gift campaign. We believe in this grassroots effort. And we already launched this 9 months ago with the help of a lot of talented individuals. Now 7,000 pledgees, 7,000 have signed up that are ready to go. When we're saying, and now I have this bill here on the table, the bill is ready. And Peggy and Troy and Bill Applegate and Paul and many have been working and working. But CareDx has been in the background pushing and nudging. And I can tell you, 12 months ago, when I started talking about the Immunobill, you wouldn't believe how many people have said, this is not top of our agenda, we're not going to move on this year. And we were here a few months later, and suddenly it is coming up, which is very exciting. But I do believe that what was the comment here in the room, that there's now the time to grassroots movement. This is the moment to sign up, and this is the moment to become part of the Honor the Gift campaign. Now, you can do that through your organizations, absolutely, but there's one place you could go if you want to go specifically and completely dedicated to the Immunobill. Because what I learned in my career, you have to have passion, but then you have to have a crystal clear focus. You have to have one page with the key bullets, and you have to have one language and one set of numbers. And if there's a lot of confusion with politicians, and you spend too much time and too many words, you lose them. Right? So think about the 30 seconds. You have the elevator. So what are you going to say? So that's what maybe Honor the Gift campaign will help on the Immunobill. So the Honor the Gift, I think that was said Azar and his story, tremendous activity. There were a lot of pieces. I do think that as an organization, we can provide you, the transplant village, with humans and resources to be successful. I also like to put in a plug. For me, I always have an objective for the year, and this year was a bit jumping out of my comfort zone and getting in front of on TV. The reason why I'm doing this and the reason why I'm giving these talks is because I'm attracting more interest to transplantation and more investment into transplantation. If you think about 30 years ago, when I entered my professional career, transplantation was at the top of medical science. If you wanted to work somewhere, you would go into transplantation. That was the top of the crop. And nowadays, it's maybe a little bit oncology. Now it's a little bit oncology. I'm sure that this will come back. What you hear now called cellular therapies is nothing else than what we in transplantation have done for many, many years. It's basically you're taking something which is not working and replace it with something that's working. So, this is now supposed to be funny. We're in the spare parts business. And I hope that none of you needs it, but for those of you who need it, that it lasts a lifetime. Thank you very much for your attention.
Peggy. Who is this Peggy person? How annoying. I'm Peggy. I'm lucky enough and proud to represent the ASTS, which is the Organization for Transplant Surgeons. I will say off the bat that Troy stole everything I was going to say, but I was going to say it a whole lot better. And I know that to be true. I happen to work with a brilliant lawyer back at my law firm, Powers Law Firm, named Diane Millman, and we have been working for many years on Living Donor Protection Act and, of course, also immunosuppressant drug bill. I jotted down a couple of takeaways from all the things Troy stole from me of what I thought would be important to talk about, and I think I'd start by saying I sleep with this. This is the Department of Labor's opinion. Oh my God, we were so excited to get this, right? So isn't that great? Thank you, Christine. Yay! And by the way, what a beautiful explanation. Being a lawyer myself, maybe I'm a little jaded, But the way you described that was so very clear and obvious about what the Department of Labor has done, what the FMLA is, and how wage and index works. Thank you so much for that explanation. I think it was terrific. So how does that all happen? So all of that happens, and it's like the guy behind the curtain, right? You have to ask. There was a request, right? And it's often helpful to have a member of Congress ask on your behalf. And in this case, Jamie Herrera Butler put in word to the Department of Labor, and she's the woman Rachel talked about earlier, whose child was born without kidneys and the husband donated to the child. She put in a letter saying, hey, can you take another look at this? My law firm put together a legal analysis. So we were chewing on this, and Troy said, I swear it was in the congressional record. Something in FMLA, when it was passed, they were talking about living donation. I said, Troy, you're smoking something. You don't know anything. He was right. So I asked one of my associates at the firm to go back and look at the congressional record and see if it came up, and lordy, it did. There were two members of Congress who were having a conversation, otherwise known as a colloquy, and in that colloquy, the one member said to the other member back in 1993 or 92, before this passed, so wait a minute, I'm really interested in this new thing, living donation. Is the Family Medical Leave Act supposed to be covering that? And the answer from the other member of Congress was, absolutely. That's what's known as legislative intent. We found the silver bullet. We found one of the magic things that made it make sense. That was not the only element that the Department of Labor looked at. As Christine was suggesting or saying, they also looked at other factors, how the law was written, what the law actually said. So my firm pulled together a legal analysis that we hope also fed that conversation and what we think is a brilliant decision, and don't tell people I sleep with this. I'm kidding, just very excited about it. So beyond that, more important to all of this really is the patient story. So I'm a lobbyist, and an advocate, right, Richard? And also a lawyer, but my family still talks to me. And when I go up to Capitol Hill, oftentimes with the transplant surgeons, I say to them, where's the patient? And that's when we call Richard and Paul and say, can you send us a patient? Can somebody come to the Hill and we can have this real conversation with the patient and with a transplant surgeon? And they do. Every time we've asked, they have volunteered from your groups somebody to come up and have that conversation that is so very important when you're having it with two different kinds of people. In one of those conversations, one of my transplant surgeons was telling us a story. And she said there was a 50-some-year-old woman who was a living donor. And she got a call from her insurance company and said, hey, we looked at your form. Says here you had an operation in the last year. Your rates are going up double for life insurance. Life insurance. And the woman took it upon herself to make an admission. She pulled all her medical records, you're smiling and laughing, I know why. She pulled all her medical records out and sent them to that insurance company and proved to them that she was astronaut healthy. Of course she was. She wouldn't be a living donor if she wasn't that healthy. So if you're a business person, you're trying to sell insurance, who do you want to sell insurance to? Healthy people. Who's the very best people who you would want in your insurance pool? If you're selling disability, supplemental, or life insurance, living donors, they should be opening their doors wide open to living donors. What happened is that insurance company wrote back and said, not only are we not going to raise your rates, we're going to cut them. Isn't that great? She advocated for herself with her own medical records to get her rates dropped, with the clinical evidence and her own personal evidence to say, you can't do this to me. I don't want all of you to have to do that, right? What we'd prefer to do is pass these laws. And Troy is absolutely right. It's fantastic that there is such a groundswell in the states on this. You all could help. Which states hasn't it been done yet? Can you pick up the phone? Can you send an email to those legislators, the state legislators, and ask them, hey, why don't you pass this law? Look at these other 10 or 12 states. You state legislators, should be passing this law. It is now common and known that this has been done by many other states. We could use your help. The patient voice is weighing in to say, hey, we should do this in the state. So if we have a bunch of state laws, why do we need this federal law? We absolutely need this federal law to codify it in the highest law in the land so that Congress would pass something. And we love the opinion, but codifying the opinion would make it even stronger and it would stand the test of time. So as far as grassroots action or activity, certainly the Living Donor Protection Act, we beg you to try to get more co-sponsors on the bill. Troy is absolutely right. This could be the very best year to advance this legislation. Stumbling blocks, I'll be honest with you. You know anything about Jerry Nadler? Judiciary Committee, he's been kind of busy, right? Democrats now run the House, and they've been focused on this administration. Not a surprise. We are trying to get them refocused on us, and they have had preliminary conversations with those other 4 committees of jurisdiction to say, why don't you just waive jurisdiction? You don't really have to take on this as a committee anymore because the Department of Labor has spoken. It isn't an unknown thing. The Department of Labor has spoken. You committees have the power, the right, and I think the responsibility to just waive jurisdiction and let this bill move along the way it should move. We do not think it should cost anything, as crazy as the Congressional Budget Office is. Where's the cost? We've already got a Department of Labor opinion. The other stumbling block over the years had been, and this is such a congressional thing to say, we're going to open up the Family Medical Leave Act. As if there would be thousands of amendments and things would change and the world would go absolutely screwy and crazy. If you know anything about congressional procedure, that's not really going to happen. And it's certainly not going to happen again because of the Department of Labor's opinion. This is a very succinct, tightly written, circumscribed for this population because of their read of the law. In establishing a federal law that happens to invoke the Family Medical Leave Act, I don't see any reason legislatively, in the legislative process, that you'd have to, quote unquote, open up the Family Medical Leave Act. So if you hear any of that junk from people, push back. Continue to push back. There is no need for a giant debate on reworking the entire Family Medical Leave Act. This has been said, and this is something we should rely on. Other than that, I just wanted to give a little bit of props to the Living Donor, National Living Donor Assistance Center. Does anybody know about this? Anybody used it? Okay. NILDAC, as it's known, is a grant from the federal government that pays for transportation, food, things that are incidental to the living donation, to the transplant itself for the living donor, to remove those disincentives that Peter was talking about. Congress is on its way, we think, and thanks to those of you in the room who worked on this, to funding that program, that very, very important removing disincentive program, at a higher amount, at a much higher amount, actually, which could be wonderful going forward. So we think this is happening, and it's exciting because removing those disincentives will make it, we hope, a whole lot easier for people to say, I'm not going to lose my job, and I'm not going to lose my security as far as my insurance goes. What struck me, Christine, that you were saying is that FMLA already covers health insurance. So the Living Donor Protection Act isn't about health insurance, just to make that real clear. It's about disability, supplemental, and life. If you're a young person, you have a couple kids, those things are really important. You know, what if something happens? Those kind of insurances can be very important to you. So if you have those insurance companies who are saying, I'm going to discriminate against you because you're a living donor, that's hogwash. We can't allow that to keep continuing, frankly, out of ignorance. Not blaming those insurance companies. I think they literally just don't know any better. They have a form that says, did you have surgery? They don't really want to know about you or your sister. They just have a form. So let's educate them. Let's do better in advancing this legislation because, as many have suggested around the room, we're close. We're closer than we've ever been on this bill. And with your help, we can carry it over the finish line united. Thank you.
Hello. So my name is Jonathan Hadak. So I have the interesting perspective of both being a kidney patient as well as a biomedical researcher in the field. I currently work at Mount Sinai in the nephrology department in New York City. So I know how personally grateful the patients are, being one for myself after receiving a transplant from my sister. And I see how grateful the nephrologists are and the transplant nephrologists are in what is done for their patients and the effort that they put into serving them and what goes on behind the scenes. I've been in conversations with somebody and they get a page or a text on their phone and then they just literally run out the door. So I was diagnosed with kidney disease when I was a senior in college at 22 years old. Like most 22-year-olds, I thought I was invincible until one day my feet, seemingly out of the blue, swelled up to about twice their size, went to the doctor, and found out I was kidney failure. Just casually skipping over the next 4 years of my life, I recently got a transplant from my sister this past March after about 2.5 years on dialysis. Yes. So after the surgery, I felt great, getting better every day. My sister, not so much. So kidney transplant is one of those things that's so involved, so complicated, so intricate that the devil is truly in the details. For me, one of those details was that my sister's recovery wasn't exactly normal or standard. Although there might be a template for these types of things, it never really goes to plan. So for her, she didn't have any major complications. It's just for over 2 months, and even still to this day, but not as bad, she had lingering pain, just severe fatigue, and just other minor complications. When I think most donors are usually back to work and feeling relatively good after a few weeks. She works as a physical therapist, and she deals primarily with very young children, toddlers, and babies. And as part of her job, she needs to interact with them, she needs to play with them, get on the floor with them, hold them. And these were all things that were really, she just couldn't do them because of the complications from the surgery. So in her case, unfortunately, life goes on. She has kids of her own, she has a family that she needs to take care of. So she had to go back to work after a month and a half or so, probably earlier than what would have been medically advisable, but such is life. So she really got the short end of the deal there. She gives her kidney, brother gets off dialysis, and she's forced to go back to work. Although she ended up being my donor, while I was on dialysis, I had several friends of mine around my age, low to mid-20s. They offered to be my donor, and several of them did go through testing. For one reason or another, it ended up not working out. But I think that especially young people that do donate their kidney or even consider it, some of these pitfalls are especially relevant to them. I can count on no hands number of friends of mine that were considering this that have a life insurance policy. I don't think it's so much out of a lack of responsibility as we're just not at that point in our lives. We don't have children of our own. Most of us don't have a spouse to take into consideration for these matters. But if one of them had been my donor, or if a young person does donate a kidney, what happens when they do reach that point in their life? Are they going to be denied? Are they going to have to pay higher premiums for a sub-quality plan? And I know this bill isn't really about health insurance, but you can never really be too sure what's going to happen in that arena, and the same thing applies there. I personally believe that no good deed should go unpunished. I think maybe a more applicable rephrasing of that is that we as a society should do our very best to at least make sure that no good deed, especially one as big as a kidney or organ donation, is punished, or at least the consequences and punishment is mitigated in any way that we can. Making the decision to donate an organ or a kidney is a deeply personal one. I think that among the myriad of considerations that go into there, the ones that should absolutely not enter the equation are any considerations of economics, impacts on your career, and impacts when you're applying for services later on, like life insurance and health insurance. I think that especially for younger donors, I know people my age, most of us are still in school or we're at the earlier part of our career. Even though it might not be strictly legal, the idea for a lot of us to go to our employer or our boss and say, hey, I'm going to go donate a kidney. By the way, I need to take off, a significant amount of time for the surgery and the recovery. And when for some of my friends, that idea is just laughable. And when you're that earlier on in your career, even if you do suffer consequences of it, even if you are discriminated against, it's not as easy to prove because you're just starting your career. You have no position. Maybe you don't advance. So I think there's really very little at the federal level to protect the people that make these donations and gifts. Thank you.
Thanks, John, and all our speakers. I'd like to welcome everyone up here and open it up to questions from the audience.
In regards to active duty service members, how will the Living Donor Protection Act cover them? Because I have received mixed answers. When I was pursuing a living donor, I had friends who were active duty, and I had a couple who got approved to get tested, and a couple who were like, absolutely not, that's not even an option for you. So are active duty service members going to be included if they want to pursue being a living donor for an individual?
Turn that over to the attorney.
Oh, great, it's my fault. So the Living Donor Protection Act is not limited by category of people in the way that you're suggesting that it would accept out or put in activity, which means it would cover you. I'd also want to turn to Christine and talk about what Family Medical Leave Act covers. So when you're talking about the person who's donating, I wasn't entirely clear about, people were told you're not eligible to be a living donor for clinical reasons or for?
No, it was kind of sort of commander's discretion. Like basically, it was dependent on their commanding officer, their leadership, whether or not they were allowed to even be tested for a living donor.
Wow.
Yes.
Well, just as far as I'm sorry.
Yeah.
I was just going to add, I have heard 2, 3, 4, 5 times anecdotal instances like that with military in terms of just, are they eligible to be a donor, and what you just said, being discouraged from doing so. I don't know, I can't speak to what the legal protections would be, but I have heard in my 20-some years with the National Kidney Foundation that does sometimes come up.
And as far as the Family and Medical Leave Act, it can be a little bit confusing because we talk about military family leave. The FMLA itself doesn't apply to active duty military. So as an active duty military member, when I was describing the right to take leave from work, that's not applicable to you. So it's not, but as far as when we talk about military family leave, that's an employee who has a family member who is active service. They can take leave in certain circumstances for their care.
I think, Paul, is this something we can look into and help out with? Yeah. There's also associations for active duty military folk that you might we can connect with and see if we can be helpful, because to me, that sounds horrible.
Well, it kind of is.
Is there a way to change that,
I mean, this discussion isn't even, when I was active duty, it wasn't even a factor. It wasn't something that was discussed, like, from a leadership standpoint. How do we address if we have service members who, they might have family members who need a kidney and they want to donate, but they're not allowed to because needs of the Marine Corps, needs of the military, mission first. And I feel like that's unfair. if you expect these young men and women to be the representative of what a true patriot, what a true American is supposed to be, serving their country, why can they not take care of their own family members in such a selfless way?
Wow, it's something to fight for. I think it's a good question. Other questions or comments? Anybody experience any of the things we were talking about? Want to share your story? Come on, we weren't that good. All right.
Well, I recently separated from the Department of Labor, but I will say it was very helpful in me dealing with my kidney disease and recovery and dialysis and things like that. I did take some leave without pay, but I never had to worry about my job and my position. So the FMLA is definitely needed and appreciated, especially when people are going through health crisis. So I appreciated that.
Does anybody work at a company that does the great stuff that Peter's company does with the LEADER program? Wouldn't you like to see more of that? Companies offering that to their employees. I think that's really incredible. Okay. Other stories, or Ed, do you have any questions for us?
I think that's time to wrap it up. I think
Okay.
that's what we're doing.
Thank you.
Thank you, everyone, for coming in. We're gonna take a short 10-minute break.